Guys, how are you all doing? I hope you all doing well. So today I'll be talking to you about allied courses. People always think that any health courses must be medicine, must be nursing, but no, there are so many health courses out there that can actually help you get into the health industry, and they are called allied health professionals. So I'm going to be looking at 14 allied health professions you can start today if you think that working in a health sector is for you. If you want to be a health professional, there are I'm going to give you 14 allied health professions you can do today. Okay, one, I'm sorry, I'm going to be looking down my phone because everything is on my phone. Number one is art therapist. So art therapists use art as a form of psychotherapy to encourage clients to explore a variety of issues, including emotional, behavioral, or mental health problems, learning or physical disabilities, life-limiting conditions, neurological conditions, or physical illnesses. People of all ages, from children to the elderly, regardless of artistic experience, use art therapy in this way as an aid to supporting them with their particular concern. It is not a diagnostic tool, but rather a mode of communication and expression. As you can see, if you're into art, I know some people are when it comes to art. So art is actually something that can help in healing. You know, in this part of the world that we are in, they believe in things like this, like therapies and all of that. So there are people that can actually benefit from your skills as an art professional. So you can use your artwork to actually heal so many people. So if you're an art person, or you're looking into what kind of course you can do, and you like art, so being an art therapist can actually help you get into that health profession. Number two is drama therapist. Drama therapists are both clinicians and artists that draw on their knowledge of both theater, drama, and therapy to use performance arts as a medium of psychological therapy. Clients are able to explore a wide variety of different issues and needs, from autism and dementia to physical, sexual abuse and mental illness, in an indirect way, leading to psychological, emotional, and social changes. If you're a drama person, if you're an artist, if you're an actor and actress, as you can see, your skill can actually bring healing to people, especially people that have ADHD, autism, mental illness, and so on and so forth. Number three, music therapist. Music therapists engage clients in the live musical interaction so as to promote an individual's emotional well-being and improve their communication skills. If you're into music, your music can heal so many people. It can heal the soul. It can bring someone back to his or her normal life. It can help the person in his or her communication skills. It can improve the person's interpersonal skills and improve the person's confidence. Okay. Number four, podiatrists. Podiatrists provide essential assessment, evaluation, and foot care for a wide range of patients with a variety of conditions, both long-term and acute. Many of these fall into high-risk categories such as patients with diabetes, cerebral palsy, peripheral arterial disease, and peripheral nerve damage, where podiatric care is of vital importance. I think so many people know about this already. So yeah, it's a good career that you can get into if you're interested in working in the health sector. Number 5 is dietitians. I'm sure everyone actually knows about this without me having to actually read into it. Dietitians assess, diagnose, and treat diet and nutritional problems. Number 6, occupational therapist. I'm sure this is actually not new to many of you. So as an occupational therapist, you work in the NHS, local authority social care services, housing, schools, prisons, voluntary and independent sectors, and vocational and employment rehabilitation services, as well as in education and research. So occupational therapists work with people of all ages with a wide range of problems resulting from physical, mental, social, or developmental difficulties. Number 7, operating department practitioners. In short form, they're called ODPs. They are highly skilled healthcare practitioners that support patients of all ages during each phase of the patient's perioperative care, anesthetic, surgical, recovery. So as well as providing this specialized care, ODPs are responsible for preparing the operating theater and maintaining communication between the surgical team, operating theater, and wider hospitals. ODPs typically work in operating departments. However, their skills are increasingly being needed in other critical care areas within the hospital. I have a friend that have worked as this, but as a healthcare assistant ODP, and she actually loved it. Now she's doing nursing. She actually wants to get into it full time and do it as a course, but unfortunately I think she couldn't get admission into it, so she decided instead of wasting time or instead of continuing to be a healthcare assistant, she would rather just go and do nursing. So, and from what she's been saying, it's actually a very good one. She loved it, she enjoyed it, and she wanted to further her education in it. Number 8, orthoptist. Orthoptic clinical practice encompasses both diagnosis and treatment and is wide-ranging. They help premature infants with retinopathy of prematurity, children with reduced vision due to squint, adults and children with eye movement defects due to diabetes, hypertension, endocrine dysfunction, cancer, trauma, and stroke. Orthoptists work in acute hospital and community settings in health and education, often as part of a multidisciplinary medical, nursing, and allied health professional team. This is actually interesting. Number 9, osteopaths. Osteopaths take a holistic view of the structure and function of the body to diagnose and treat a wide variety of medical conditions. Their work is centered on the principle that the skeleton, muscles, ligaments, and connective tissues of an individual need to function smoothly together so as to maintain well-being. They use a number of non-invasive treatments such as touch, physical manipulation, stretching, and massage to restore bodily equilibrium through increasing the mobility of joints, relieving muscle tension, enhancing blood and nerve supply to tissues, and encouraging an individual's own healing mechanisms. Number 10, prosthetists and orthotists. So I'll call it P&O. P&O are autonomous registered practitioners who provide gait analysis and engineering solutions to patients with limb loss. They are extensively trained at undergraduate level in mechanics, biomechanics, and material science, along with anatomy, physiology, and pathophysiology. Their qualifications make them competent to design and provide prostheses that replicate the structural or functional characteristics of the patient's absent limb. This is interesting. So if you're interested in joints, bones, and all of that, I think this is for you. Okay, and number 11, paramedics. Everyone knows about paramedics without even having to read it out. They work with ambulance, isn't it? So let's go into it. Paramedics are the senior ambulance service healthcare professionals at an accident or a medical emergency. Often working by themselves, paramedics are responsible for assessing the patient's condition and then giving essential treatment. You're happy if you're good in helping people and you're not scared of blood, you're not scared of, very dangerous situations and all of that. If you're someone that is adventurous, I think, yeah, you should be able to do this. Number 12, physiotherapist. Physiotherapy uses physical approaches to promote, maintain and restore physical, psychological, and social well-being, working through partnership and negotiation with individuals to optimize their functional ability and potential. Physiotherapists address problems of impairment, activity and participation, and manage recovering, stable and deteriorating conditions. Number 13, speech and language therapists. Speech and language therapists in the UK work with children and adults to help them overcome or adapt to a vast array of disorders of speech, language, communication, and swallowing. These include helping young children to access education, working with young offenders to enable them to access the programs designed to reduce reoffending, reducing life-threatening swallowing problems in the early days after stroke, and providing essential support to adults with a range of acquired neurological communication difficulties to help them return to work and their roles in their family and society. Interesting. The last but not the least, radiographers. There are two types of radiographers: diagnostic radiographer and therapeutic radiographer. So the first one, diagnostic radiographers, use a range of techniques to produce high quality images to diagnose an injury or disease. They are responsible for providing safe and accurate imaging examinations and increasingly also the resulting reports. Radiographers are also key team members in breast screening and ultrasound monitoring of pregnancy. Then the therapeutic radiographers play a vital role in the treatment of cancer. They are also responsible as they are the only health professionals qualified to plan and deliver radiotherapy. Radiotherapy is used either on its own or in combination with surgery and or chemotherapy. So yeah, this brings us to the end of our topic, which is 14 allied health professionals. I hope you got something out of this. At least if you're thinking of going into health, now you know it's not just medicine or nursing. There are so many other health professions you can go into, and these are one of them. I know the most surprising one is art, music, and drama. I know they are. I think it's in line with therapies, because here in the Western world, therapy is a big thing, so they value a lot, especially for mental health. That brings us to the end of this video, and if you like this video, please smash that like button, and I will see you all next time. If there's any topic you want me to treat, kindly feel free to leave it in my comment section, and I'll be more than happy to do the research and come and bring it to you. And if it's something I cannot talk about, we'll simply go through it together like we did today. That's it. Thank you, and see you all next time. Bye.